One second, the screen share's loading. Thanks everyone so much for joining today. We're very lucky to have Dr. Heather Stimatt from Blue Cross Blue Shield here, and is going to spend some time today talking about a predictive analytics model that they've been working on. And we also will have Dr. Mike Hung, our nephrology program director, on the call as well to share a bit about how this aligns with the work of MCT2D and what we're trying to achieve with nephrology care as well. So with that, I will hand it over to you, Dr. Stimatt.
Great, thanks, Jackie, and nice to be here, and thanks for having me spend a few minutes to talk about some of the new and exciting work that we're doing at Blue Cross Blue Shield of Michigan. If any of you were at the PGIP Quarterly in September, I did give an afternoon breakout session about some of this work, but again, as Jackie said, we'd like to just tailor it and give you a little bit more information how we can use part of this work alongside of MCT2D and all the great things that are being done through the CQI. So go ahead, next slide.
Oh, sorry.
Oh, sorry, yeah.
It's okay. Sorry about that.
No worries, no worries. And again, I'm working off a laptop, so thank you for sharing the slides for me. It's a little difficult trying to present and do it at the same time. So again, a couple of objectives for today. Real quickly, we're just going to go over how predictive analytics can play a role in healthcare, and then understand a little bit more about what we've developed at BCBSM, and then the future of predictive analytics. And then at the end as well, I'm going to talk about specialist team-based care too, and how we can incorporate all of that together. Next slide. So again, I think all of us realize that whether we realize it or not, we are using predictive analytics every day in our lives, from the apps on our phones to in-home devices. Again, it has become a part of our life. And I know there's got a lot of good and good news and publicity out there, but there's also been some other publicity out there that may not be so good, and especially when it comes to healthcare. And I think a lot of this is just because it's so new when we're thinking about using predictive analytics, or another name would be artificial intelligence when we're looking at healthcare. And again, I think all of the news that's been out there, especially in healthcare, is all very good, because again, like anything in any type of new technology, you want to be careful with how you're using it, and making sure that it's being used in the appropriate way. But again, what we've been working on at BCBSM is really trying to think about how can we use predictive analytics in order to help increase operational efficiencies. Again, many times when physicians and providers are in the office and they're working on their EMRs, and depending on what EMR you're in, you may have a flag pop up saying, okay, this person is due for this type of testing, or they're overdue for this screening. But again, it's really difficult to have all of that data aggregated into a list, something at your fingertips that you actually might be able to do something with ahead of the patient visit. So again, with all of that, and how we've been thinking about it is, how do we use some of these capabilities that are in existence right now, and try to create new tools and look at patient care a little bit differently. Next slide, please. So this past year, 2023, we have actually worked on 2 clinical predictive pilots. I'm only going to spend time today talking about the chronic kidney disease one. But again, what we did is we developed a pilot and worked with 4 different physician organizations to actually take the information that we were predicting and try to look at that in the office type setting and operationalize it and see how they worked. We met with the POs monthly, getting feedback, and really tried to take what they said, and what worked, what didn't work, and try to get a lot of information ahead of time before launching this capability to the network. So again, the chronic kidney disease model is been developed to identify patients who are at risk of either being undiagnosed, underdiagnosed, or developing chronic kidney disease within the next 12 months. And again, the pilot went from June until September of this year. We are still sending the list out to the physician organizations through the end of this year, and then hoping to launch this to the greater provider network early 2024. Next slide, please. So again, as I mentioned on the previous slide, the goal with using predictive analytics is to, be proactive in care. And so much in medicine, we're actually reactive, and especially in chronic kidney disease, so many times, when I was in practice, patients would show up to the emergency department and, we'd call them crashing into dialysis. They would have no idea they had any type of, problems with their kidneys, had no idea they, now needed emergent dialysis. They had absolutely no idea. And, it's traumatic. And again, too often, that's happening, and in this day and age, it really shouldn't. Again, if we are able to, screen individuals and educate patients about problems with their chronic kidney disease and risk factors. So again, using the predictive list, we are hoping to be more proactive, being able to identify those who may have a risk of chronic kidney disease, may have the wrong stage attached to their kidney disease. Again, to be proactive. There's so many times, and we have so much opportunity. Those with chronic kidney disease usually are asymptomatic until they're late stage. So there are 90% of the population out there walking around that probably have some degree of CKD, but have absolutely no idea that they have that diagnosis. Next slide. So what is the CKD model trying to predict? We have built two models into our predictive piece. And the first part is that we are looking at labs. If we have lab on file at BCBSM, we are taking those lab measurements, one that's called the GFR, that's the blood measurement of how the kidneys are functioning, and the other is the ACR, that's the urine testing. And we're taking those two tests, and then we're looking at different time points, and then we're assigning them a risk category using the KDIGO heat map. And that's a clinical evidence-based tool that's been around for over a decade. So again, just using clinical evidence that's already been validated, taking those tests and risk stratifying them to that category. The other piece that we're also doing is that if we don't have lab work on an individual, there isn't lab testing that we can see in our claims, and or there has never been a CKD diagnosis attached, we are identifying those members who may develop CKD in the next 12 months. Again, using a multitude of risk factors that we've developed into our model. Next slide, please. So you can see here, all of the individual characteristics and features in the dark blue boxes are just some of the features that we have developed into the model. So anything from member age to gender to SDOH features, and then all different types of different features in the health profile we've incorporated into our model. And the graph on the right is an example, a real life example of one of the cases that we were doing the testing that we actually ran through the model. And you can see here that if we had this model back in 2018, we would have been able to identify this patient, a 61-year-old male, where that red line, dotted red line, like March of 2018, he would have come on our list of showing to be at risk for chronic kidney disease. However, we did not receive a claim from Blue Cross Blue Shield until December of 2019, actually diagnosing him with chronic kidney disease. So again, if we would have had the model way back when, we would have actually been able to flag him over a year in advance of being at risk for chronic kidney disease. And again, with hopes of that, we'd be able to intervene earlier, if it was, as a result of diabetes or hypertension, place appropriate meds. So again, that's the whole thought. And again, I thought this would be a good example for those of you on the call to see, what we're trying to do here with using this type of predictive model. Next slide, please. So again, as part of the pilot and as part of moving forward with the predictive list, you can't just give a list of patients and say, good luck. Really what we've really tried to think about this, from a clinical standpoint and operational standpoint, because the predictive lists are being targeted for the primary care physicians. So again, with PCPs and staff knowing they have so much on their plate with every type of comorbid illness out there, really trying to help them out, okay, here's a list of patients, here's, the risk category that they're in, but what else would you need to do at that point once you have this information? So part of the project that we're looking to do is, we will, provide a predictive list, but we also have a toolkit that we've developed that has, overview of information, clinical recommendations, coding, guidelines on HEDIS measurement, again, and additional resources for the providers taking care of these patients. So again, we would like to, use the list and give the, ancillary resources to help with this as well. Next slide, please. So here is an example of what the list will look like. And our plan is to actually launch these lists and combine with the provider delivered care management list that will come out monthly. And this is set to begin in March of 2024. So on the PDCM list that we send out to all the POs, we will have, it'll look like the box on the right. So you'll have the clinical risk category, the lab risk category, because patients will be in either or. And then if they've changed, and then if there's any other information, and then if we do have a CKD diagnosis, we will also have that on the list for you. And again, in the toolkit, we have the KDIGO heat map that they'll be, we'll be able to teach you and learn how to, risk stratify these patients. Next slide, please. So again, this is just an example of one page of the toolkit that gives, detailed information. And again, as I mentioned, part of the toolkit is, what are the appropriate screening labs that should be done at, a particular stage? How do you classify, what's the ICD-10 code? And then best practices, and then best practices also for timing of a nephrology referral. Next slide, please. And then, as I mentioned, we will also have additional resources. So we've been working together very closely with MICMT. We currently have 3 on-demand webinars that are on their website right now as they relate to pharmacy, as well as diet recommendations. Again, sometimes these 2 areas are really difficult, especially for primary care physicians to have resources. So again, these are on-demand webinars that are already on their website that just give, clinical information that providers and, patients would be, very welcome to be able to see. We are also planning additional webinars early next year. Again, we have panel discussions lined up. Those will begin in March. So we have March, April, and May that we'll be looking to do monthly live webinars just to go over best practices, screening, and then we have one that we'll be talking about home dialysis modalities as well. Next slide, please. So again, just to give you an idea, this past year in 2023, we really worked with the physician organizations to pilot these lists and, go over, the positives, the negatives, what we needed to fix, what worked, what didn't work. Again, trying to gain as much information prior to launching to the full provider network. So 2024 in March is when these patients will be on the PDCM list for the POs. And over 2024, we are hoping that we can, gain some support from the physician organizations to help us spread the word and distribute these lists out to the practices. We did develop a PGIP incentive for POs who would like to help participate. And then also part of that reward will also go to PCPs who would like to participate as well for 2024. So again, happy to share more information and answer questions as needed. We also have information on the will be coming up on the PO Collab site. Next slide, please. So again, as I mentioned, here's the PGIP incentive, and we would need to know from the POs in February if they are willing to participate, as well as with the PCPs. And again, really looking for participation only this year. We do have a form that we're asking the POs to fill out, and then a mid-year report just to see how it's going. But other than that, it's really, again, just trying to let everybody know that we do have this tool available, and then hoping, we can get as many POs to participate as possible to start using this type of enablement piece. Next slide, please. I just want to take the next 1 or 2 minutes just to kind of give a brief update about specialist team-based care as well. So because this all kind of goes together, and we're really encouraging, the use from the specialist PDCM piece as well as the PCP. And again, the predictive list is kind of a good way to kind of introduce both of them. Next slide, please.
Dr. Simmet, before you move on to specialist team-based care, there were a couple questions in the chat. Would you like to address those, or would you like to wait to the end?
Let me just go over the 2 slides, Jackie, and then I will address everything if that's okay, because I only have a couple slides left.
Perfect. That sounds good.
Perfect. Next slide, please. So again, specialist team-based care was first started in 2020. And again, I think it's been a little bit more difficult to take off because of when it started during COVID, and everybody had higher priorities trying to get everything taken care of at that point. But really, I think it's a great program, and really, as far as as far as providing care management in the specialist offices, it's not as we focused on the PCPs at first, but we're really trying to see that care management needs to be both ways. And so with the specialist team-based care program, 5 specialties are eligible to join. We have cardiology, and then endocrinology, nephrology, oncology, and pulmonology. So again, highlighting both endo and nephro here with MCT2D. Again, great opportunity for POs who may have not signed up yet, and really trying to think, how can we incorporate the use of the predictive list on the primary care end, and then also specialist team-based care of working together with this information at the specialist level. So again, in order to participate, the POs have to apply in the first quarter of the year. So again, reaching out because the applications will be coming due early 2024. And then again, if the POs are accepted, there's some infrastructure funding for initial participation, as well as ultimately being eligible for VBR. Next slide, please. So again, all of the goals that we look at for specialist team-based care, again, really trying to increase that collaboration from the PCP to the specialist office, and then using care management to be the conduit for that. Again, everyone is so busy, but if we have care managers in the PCP office, and then also care management at the specialist piece, that is a great way to be able to use both resources to help increase that collaboration. Next slide, please. So again, eligibility, it's from the PO standpoint, the PO has to apply. Then again, of course, the specialists have to agree, and then, really trying to institute care teams into the specialist office, and the infrastructure funding that is available through specialist team-based care is to help set that up if the specialist office does not have a care management already in place. And next slide. And again, Jackie was so kind to pull this data for me. Again, trying to take a look at who, from a nephrology standpoint, who's in MCT2D, and then who's already participating in specialist team-based care. And you can see, there's 15 nephrology practices already participating. 6 are currently in specialist team-based care, but 9 are not. So again, just wanted to, put all of this together to think about how we can collaborate and use some of these, new programs and existing programs in order to increase that collaboration for both PCPs and specialists. And I can take a look at the questions in the chat now, Jackie. Let's see.
Do you want me to read them out to you?
Yeah, can you? I'm trying to click up here, but I'm getting only part, I think.
Absolutely. So we have 3 questions. First, will the incentive be coming to the PO or to the provider?
Both. So there'll be a PO incentive, and then there'll be an individual PCP incentive as well.
Okay, great. Is the form available yet? The form to, I think, sign up to enroll, to be part of it?
Not yet, Gina. It's coming. It should be on there within the next 2 weeks.
Okay. And then the final one was, when will attestation be sent out?
The forms will all be loaded onto the PDCM portion of the PO Collab site, and that is supposed to happen in the next 2 weeks.
Okay, perfect. Are there any other questions before we turn it over to Dr. Hung to talk a little bit about how he sees this program aligning with the work of MCT2D? No? Okay, I will stop screen sharing and turn it over to you, Dr. Hung.
Thanks very much, Jackie, and thanks, Heather, for the great presentation. I've had a chance to hear that presentation a couple of times now, and it gets me excited every time I hear it, because I think it's just so important, exactly the direction we need to go in. So, I mean, to very simply answer the question of how this aligns with MCT2D, I think it's perfectly complementary. This is looking at an upstream approach, and I think that is so important because we have more tools today than we ever have before to help prevent progression of kidney disease. So in the past, it was kind of like, it's going to happen, we're going to watch them, we're going to try to prepare them. but the entire paradigm has changed, as hopefully all of you know and are starting to see with the newer medicines, the ones in particular that we are focused on as part of MCT2D. We know now that we can very significantly slow progression of kidney disease, and in many cases prevent progression of kidney disease or even reverse to some degree. But obviously the best success at that is to do it as early as possible. And so right now, as part of MCT2D, we're incentivizing practices to utilize the therapies to the best degree, utilize these great tools we have now. What we haven't done is we have also provided some opportunity lists to practices, but not based on predictive analytics like what Dr. Stamatis described. So I think very much this is an extension of the efforts that we have in MCT2D, and brings us even further upstream, and ultimately will hopefully improve even more the outcomes in patients at risk for kidney disease. And I always like to joke that, these days we have these tools that are hopefully good enough to put me out of business. I'm not actually worried about job security, unfortunately, but if we do happen to cure kidney disease with these approaches, I'm more than happy to find other things to do. So I'm happy to take any questions as well.
Well, thank you both so much. We really appreciate it. Thanks again, Dr. Summit, for joining our call today and going over that. Can we distribute the slides to the attendees? Is that okay with you? All right, perfect. We will make sure to get everyone the slides that were presented today as well. And with that, we can turn it over a little bit early to Inhale for their portion of the meeting.
Thank you, Jackie.
Thanks a lot.
We'll give everyone a minute just to drop off. Thank you, everyone, for joining us today. I just want to briefly show the, sorry, I'm having technical difficulties here. Apologies for that.
Maple, you should be the host now. Is it related to that?
Okay, can people see my screen or not?
Yes.
Okay, great. All right, thanks, Jake. Here's our agenda for today. So we have a few announcements. We want to touch briefly on the MTI pilot project that's already launched, an update on our lung learning labs, our VBR timeline, highlighting some of the Ask the Pharmacist enhancements that we've done to our website. Additionally, our 2024 recruitment. Brenna will be joining us. She's our project manager on Inhale to talk about updates that have occurred on the admin portal as well as the website. And then we want to point out that we will have a 4-question survey for Blue Cross Blue Shield that we would appreciate you all completing, and then just going over some of our upcoming events as well as answering any questions that you may have. I just wanted to point out that the coordinating center will be closed from December 25th until January 2nd in observance of the holiday. The MDC support line will still be open. So if you're experiencing issues with the data dashboard, you can still reach someone through MDC, and they will be able to address any technical issues you may be having with that. We will, obviously, if you have concerns or questions, please email us and we'll get back to you as soon as we return. The resource bags, we have an update on that. Several shipments went out last week. So McLaren shipped on 12/6, IHP also shipped out that day, and UMMG has a confirmed delivery of 12/11 today. So the requests from the Rochester regional meetings will be filled as soon as we receive the remainder of the supplies. I think we're waiting on a poster. So those should be going out probably for either late next week or at the beginning of January. We did have a meeting with some of the interested POs with MTI over the last week or so. If you are still interested, you're able to complete the questionnaire, which is linked here. These slides will be available after the meeting. Just go ahead and fill out the site profile, and Sean and MTI will be in contact to arrange an informational meeting one-on-one if that's something that you're interested in. We probably will not close recruitment for this until the end of second quarter of 24. If you missed the session and you'd like to look at or watch the info session that we had as a group with MTI, it is located on Inhale's YouTube webpage, so you can just go to our YouTube site and watch it from there. If you have questions, please feel free to reach out to us. We'd be happy to address any questions you may have regarding the spirometry pilot. I do want to point out that Inhale has updated their VBR timeline for 2024. This came as a request from Blue Cross Blue Shield. So for the 2025 VBR, meaning the VBR will pay out in 2025, the measurement period will start 1/1/24 and end 8/31/24. The reimbursement period for specialists will be 3/1/2025 to 2/28/26. And for the PCPs, it'll be 9/1/2025 to 8/31/26. For years 2026 and beyond, the measurement period will align from 9/1/2024 to 8/31/25, and then obviously as subsequent years go on. And then the reimbursement periods will be 3/1/2026 to 2/28/27 for specialists, and 9/1/26 to 8/31/27 for PCPs. This alignment is helping with a more equitable payment timeline. So SCP specialists had a 15-month lag for reimbursement. It's now going to be a 12-month lag. And we understand that we had participation that started previously for 12/1/23, and we at the coordinating center will count that towards and honor that for your January 1/24 participation VBR activities. If you have any questions related to that, please reach out to the coordinating center. We'd be happy to address any of those questions you may have. Additionally, the alignment of this timeline does reduce administrative burden on Inhale and Blue Cross teams, as well as making it easier we're hoping for the POs to track the VBR payments. The Lung Learning Labs are kicking off in January. We're really excited about that. All clinical champions and all participating physicians must attend one session to earn VBR credit. So any of your participating providers at your Inhale practices who are a member of Inhale are expected to attend either one live session, or they may go in and pull it down from our learning platform or YouTube channel and review it at a later time, and they will still get credit. We are asking that they complete that information on the admin portal, or you as their site liaison could go in and complete it as well for them. And then if they would like CME, they can claim CME whether they attend virtually or in person. So you can see the topics are anywhere from updates in COPD, we have a biologics section, we have a lung volume reduction, and then a spirometry interpretation in primary care. So if you have any questions about that requirement or meeting that requirement, please feel free to reach out at our info-support email address, and we'd be happy to address those for you. Ask the Pharmacist. So we have had this program ongoing with MICMT for the past year, and as a provider, you're allowed 2 individualized one-on-one sessions. You can also attend the virtual office hours. Nada can provide resources specific to your practice. She can answer clinical questions. She can answer patient questions. You cannot exchange PHI information. We also have added a Ask the Pharmacist button to our website, which makes it a lot more convenient for providers to be able to locate that information to register or to schedule a visit with her. We will be kicking off our PO recruitment in February. Our information session will be February 1st from 11 to noon. We are intending to recruit 3 POs. If you know of anyone who's interested in joining Inhale, please feel free to pass along our information or contact us and we'd be happy to reach out. Now I'm going to hand it over to Brenna, who is our project manager. She's been working very hard over the last few months to update both our admin portal and our website. So,
thank you. Can everyone hear me? Okay. Yeah, so like April said, I've been working hard with the team to update our admin portal. We're making improvements, adding our scorecard in, creating some forms that you will be able to go in and mark as complete. We will be sending out announcements as these forms and different scorecards become available. Additionally, for the Long Learning Labs, registration will be held in the admin portal. We are hoping that it will open up in the end of this week or early next week. Attendees need to pre-register for the virtual event. And then after a session is attended, there will be a survey that you have to fill out to mark it complete in the admin portal. In the survey, you'll also have a link to the Beaumont portal to be able to claim your CME credit. If you or any of your attendees decide to attend a recorded lab, which will be on the platform, there still will be an option to fill out that survey within the portal and also to claim CME credit through the Beaumont portal. Next slide. There we go. So along with the admin portal, we've been making lots of changes to the website. The resource library specifically has a ton of new features, specifically to sort different resources. There's also a bookmark option to save your frequently used resources. There's different views, so you can view it in a table or a grid view. And then we also included featured photos of each of the resources, so it's easier to find. On the homepage of our website, there's some new features. You can find our newsletters easily. Also, I've collated a bunch of different events along with the different Inhale events that we'll be holding over the next year. So that's a great place to look to stay up to date with all the latest asthma and COPD trainings and different webinars and things. You can also easily access our YouTube page, and we also have a couple of our featured videos that we've actually created and developed with an outside company. So definitely check those out. There's also now an option to request resource bags through the members section of the page. Just a reminder, it is only 1 bag per practice right now. So if you want to request any additional bags for your practices, that's the place to go. Like April mentioned, we have the Ask the Pharmacist button and also now a Contact Us button at the very top of our homepage to easily set up an appointment with NADA to go over anything medication related or pharmacy related, or if you just need to easily reach out to us, you can use the Contact Us button. And then lastly, we also have a new announcement section that will be like updating different announcements, exciting news coming from Inhale, and that can be found also right on our homepage. And like always, if you guys have any questions or any feedback or suggestions on how things should be organized, I definitely would love to hear that. It's still a work in progress. It's come a long way, but love to hear your feedback. Thank you.
thanks, Brenna. Sorry. Okay. So as I mentioned earlier, we will be sending out a 4-question survey that is required by Blue Cross Blue Shield of Michigan. We would appreciate it if all of you would take the time to answer the survey today. It takes less than 5 minutes to answer. It's composed of the questions: I find value in the Inhale CQI. The Inhale Coordinating Center is a trusted partner. Our site can only participate in Inhale with financial support from Blue Cross Blue Shield or BCN. Blue Cross Blue Shield of Michigan or BCN has been a reliable partner in the Inhale CQI quality effort. If you could all please respond by December 20th, it would be greatly appreciated. You will get a reminder Monday of next week to complete the survey. Unfortunately, it's an anonymous survey. We can't tell who has completed it, so everyone will get the reminder. But we would appreciate you taking the 5 minutes to complete the survey. Some upcoming events and important dates. Our next monthly PO calls will be January 8th or January 10th. The Long Learning Lab series, as we mentioned a few times today, will be kicking off in January and will go through April. Our collaborative-wide meeting has been scheduled for June 7th in Lansing, and that will be with MCT2D. And our spring meeting regionals are May 1st, 7th, 8th, 14th, and 15th. The MOC project of inhaler education will be kicking off in the spring of 2024. Any questions for us? I see there are a few things in the chat. Okay. Looks like Chelsea's question was answered by Brenna, so I appreciate that. Are there any additional questions before we sign off today? Okay, well, again, I want to thank you all for taking the time out of your day to meet with us. If things come up in the interim that you have questions about, please feel free to reach out to us at our email address. We'd be happy to answer those for you or follow up on things that may have seemed unclear during the presentation. And as usual, if you have feedback that you'd like to provide in terms of resources that may be helpful to you or your practices, we'd welcome that information. So thank you, everyone, and have a great day.